Hello from ACR 2023, ACR Convergence. My name is Dr. Eric Dein. I'm a rheumatologist from Summit, New Jersey, and I'm here to talk about some of the abstracts from ankylosing spondylitis perspective. So one of the late-breaking posters at L11 is looking at cardiovascular events in ankylosing spondylitis. This was a large registry study from a Korean database of 43,000 patients in Korea with a diagnosis of ankylosing spondylitis. The rates they were looking at of incident myocardial infarction or CVA. They looked at if these patients were not on a biologic or if they were on an IL-17 or TNF inhibitor, and they looked to see is there a difference between those incident rates of MACE events. Patients that are not on a biologic, they found 18.7 events per 10,000 person years. They didn't, as an aside, they didn't comment about targeted synthetic, but I assume those were not included in the study, but they didn't specifically mention that on their poster. But so 18.7 events per 10,000 person years. Patients on an IL-17, they were found to have 12.9 events. So decreased, but not a statistically significant difference. TNF inhibitors, that was found to be 8.9 per 10,000 person years, so compared to the 18.7. So half the number, and certainly statistically significant. So this is certainly a large volume of patients, 43,000 patients. And the data showed an adjusted hazard ratio of 0.7 with a p-value of 0.034. So certainly showing that the patients on the TNF inhibitor were having better outcomes and having less incident MI and CVA. So this supports some of the thought that's been out there before. Is there a cardioprotective effect of TNF inhibition? How much is it from the TNF inhibition or just better disease controlling the inflammation? I think certainly more information to come, but I think this is certainly reassuring and supports that idea that maybe that TNF inhibitor does have a cardioprotective effect that prevents against MI or CVA. Thank you very much for tuning into Room Now, and stay on Room Now for lots more coverage as we wind down on ACR Convergence.